I would say it is nothing short of a much needed miracle. We've seen a whole of government approach to gender ideology starting on day one of the previous administration under President Biden, when he issued an executive order expanding the definition of sex unilaterally in all federal laws and regulations to be interpreted in such a way to include gender identity or expression. That wrought quite a bit of damage, both through housing and urban development, through the Department of Justice, through HHS and Department of Education. And what this administration now has done is say that they are putting an end to this madness. They are taking back the safety of women and girls. They are protecting the biological developments of normal pubertal children. And they are also reinstating official documentation, whereas the Biden administration said you could indicate your sex was X, a non-binary marker on official documents like a passport. That too is now rescinded. So I don't think it is anything quite like an overstatement to say that this was indeed a much needed miracle.
What do you think the most obvious immediate impact of the executive order on federal policy, since federal agencies will now be required to recognize only two biological sexes?
Yeah, probably the Department of Education. We have been following very closely all the litigation over Title IX, the Education Amendments of 1972. That's the simple anti-discrimination law in federally funded education based solely on sex. The expansion to include gender identity, as you can imagine, through bathrooms, locker rooms, dorm rooms, and sports into absolute chaos. So that is certain to be the first of the challenges. Remember that the Biden administration's already published this rule, and it went into effect in 25 states in August of last year. But now we're seeing 25 other states bring legal challenges against this. So we have a bit of a sort of game of whack-a-mole between an old, illegal, but still enforced in half the country rule, and now a new executive order going back to square one on biological reality. So there will definitely be a showdown, very likely probably destined for the Supreme Court.
And how do you think doctors and hospitals that currently perform gender-affirming surgeries or provide the related treatments will be forced to respond? Will they have to stop offering this service, like as of right now, these services?
No, they're not required to immediately stop offering the service, but for anyone, any hospital, clinician, provider who accepts so much as $1 of federal funding, and remember, that's Medicaid, Medicare, and the Affordable Care Act, what's known as Obamacare, any of those dollars cannot now be used for gender-affirming treatments. That will make these procedures a lot less lucrative. If people can pay for them out of pocket or with private insurers who don't actually restrict these procedures, and the expansion of gender identity, that will be the only way to afford it. But I am really hoping that what this does is give clinicians, hospitals, and doctors the very, I think, much needed hard second look on whether or not they can afford to even do this kind of quackery going on.
And certainly you're expecting a lot of legal challenges. We are out of time, but quickly, yes or no, are you expecting a barrage of legal implications now?
100%. We've already seen groups like the ACLU and the Human Rights Campaign claim that they're going to fight this particular executive order. It will certainly end up in court, but wherever it's brought to court, I have every reason to believe Trump will be victorious.
Big challenges and changes coming. Sarah Parshall-Perry with the Heritage Foundation, thank you so much.